folic acid is what you find in cornflakes and Flintstones vitamins. It's a synthetic form. It sounds like really good stuff, but it's a cheapo. It's a stable. It's like neat shelf life. It's good stuff, but if it's a synthetic form of B9, vitamin B9 that works pretty good. I mean, it helps prevent neural tube defects, which is one of the first reasons they put it into flour and cereal and stuff. But it doesn't agree with everyone, especially if you have certain some of these minor mutations in your methyl tetrahydrofolate reductase enzyme pathway. And so kids on the spectrum, kids with emotional issues, Hispanic children, a lot of them have, my kids probably have them, they're from Guatemala, have these SNPs. SNP stands for single nucleotide polymorphism. It's another fancy name for mutation. And we're learning, in children there's those issues, sensory processing, autism, ADHD, more increased incidence of that with SNPs, MTHFR SNPs, but when you get to be my age, strokes, coronary artery disease, other bad things like that, blood clotting disorders are associated with MTHFR mutations. So should every mother that's expecting, I just when I was driving down here, my new neighbor, who's a pediatrician, she's going to have a baby. She's actually due this week. I should have asked her while we stopped to say hello to her if she knows her MTHFR status, because it's it can affect the incidence of not only neural tube defects, which is a bad thing, but it may increase the chance of tongue tie, which seems like every baby these days, like 80% of kids have tongue tie and 90% have lip tie. I don't even know what to make of that. But
so just because folic acid, is there a relationship between that and tongue and lip tie? Is there
might be. Here's the thing.
I did read
yeah,
about them.
I have like a series of one or two now where I have had one baby where we've snipped the tongue here in our office because it was a really severe tongue tie and they're easy. And then that mom was on standard prenatal vitamins. And then for the next pregnancy, it was like, they heard maybe through Dr. Kotlow, who's kind of put the bug in the ear of some of us about this. Dr. Kotlow is the guru of tongue tie. He's a pediatric dentist up in Albany. And his speculation was that if you have MTHFR SNPs, your chance of having, and you're taking standard prenatal vitamins that have folic acid in them, your chance of having a baby with tongue tie are increased. And there might be something to that, because the second time, I took methylfolate this pregnancy, or I took a prenatal vitamin that had methylfolate or had natural methyl B12, and sure enough, no tongue tie.
That's what happened with me.
Yeah. Okay.
My daughter, she had it,
Yeah.
and I was taking folic acid, and in the prenatal, and then I read afterwards, because I was reading all about it, and then I read about something with folic acid. Then on my second, I did like the raw. When
Maybe
the
you would
folate,
have done that.
no folic acid, and breastfeeding was easy, wonderful, no tongue and lip tie. So
No tongue and no lip. That's wild.
So
Okay.
I wonder if there is.
You heard it here first.
Some truth to it, yeah.
Yeah, that's wild.
Yep.
I hope, I'm thinking that maybe 5 years from now that all prenatal vitamins will have methylfolate,
Yeah.
rather than and maybe rather than cyanocobalamin, which is kind of like the traditional cheapo form of B12, that more vitamins will have methyl B12 or S-adenosine B12, more active forms of that vitamin as well. So.
Is there a test that you can take for that gene?
Yes.
There are. There's the question that came up that started this all off was, should everyone know their MTHFR status? Or like you have your, it's like, it's so weird too. Like well, maybe we'll talk about this a little later, that the report card that HMOs use to grade doctors these days as to how severe they're going to punish us. That's the way I look at it. It's like, well, is are you doing lead testing, and how many vaccines are you giving to your kids? Those are the two benchmarks for quality, according to whether it's MVP or Fidelis, that they judge pediatricians by. And thankfully, with lead levels, our experience is like, of the first 500 kids that we tested, I think 2 had levels over 10, maybe 1. And one of them lived down the street here under the walkway of the Hudson. I told that to parents, so we've actually had more children dislocate their elbow during having a blood test, being wrestled to the ground.
Oh, it's horrible. Yeah, I did it. My
So that's the way. I'm digressing here a bit, but so bear with me. I'll come back to MTHFR. That's like the health department and the HMOs. They say, well, Dr. Bambini, you're not that good at practice because you don't coerce all your patients into lead testing, and or even worse, you send their hair for lead testing, which is they think is really like voodoo, but there's a lot of information in our hair, and I think that's a pretty useful test. It's painless. It's too bad insurance doesn't cover it. It's $90.
I think I came in the middle. MJ-Kafar, what is that?
Gene mutation.
Oh, okay.
Type of gene mutation.
Okay.
And then, sorry.
Please,
I've
MTHFR
got
stands
kids
for
with
methyl
it, so-
tetrahydrofolate reductase, which is an abbreviation for the major enzyme that controls how we metabolize folate or vitamin B9,
Mm-hmm.
and it's associated with a wide range of
Okay.
troubles. Not too much in kids. Maybe umbilical hernias. Maybe not. Maybe tongue tie, as one of our parents who took folic acid with her first child, got a tongue tie for the second baby, took folate, which is a better form of vitamin B9, and that's what probably more good quality and prenatal vitamins. And if you look in our apothecary over there, there's folate supplements, and one of the more interesting things about folate, if we want to continue to talk about that for a few minutes, I don't know if you get our newsletter, but there was pretty interesting research that came in part out of Stony Brook, published this last summer, involving megadoses of a form of vitamin B9 in children with autism. The way that worked was they found that, not surprisingly, that autism, by and large, is an autoimmune disorder. There's, you have messed up gut. That's pretty well established, although for some reason it's still a little controversial in the mainstream. But that leaky gut, the toxins, leads to immune dysregulation, and one of the consequences of that immune dysregulation, that autoimmune process where you're, when you eat wheat or when you eat milk or other things like that, it starts really setting the immune system haywire, is that our body starts making antibodies against folate receptors, particularly in the brain. These kids have folate receptor antibodies. I don't know, is it like 60% of children on the spectrum have that?
Wow.
According to the study that, so it was pretty clever. They not only picked up on that, I think maybe that research came out of the Middle East somewhere several years ago, but what these doctors did, Dr. Rosengal and some others, was like in a regular kid's vitamin or in a regular folate supplements, there's 400 micrograms 0.4 milligrams. Well, these kids got 50,000 micrograms of folinic acid, which is another form of vitamin B9, but it's folinic acid, or it's also called, the brand name is leucovorin. Maybe if you know anything about oncology, you might have heard of leucovorin rescue. It's just a form. It's like slamming kids with leukemia with methotrexate, which shuts down your ability to use vitamin B9, and then at the last minute rescuing them with this mega dose of leucovorin or vitamin B9. So they make pills with 50,000 milligrams or 25,000 milligrams of vitamin B9. If you give these kids 2 of those a day, a lot of them start talking or have,
So just that, or in
like,
conjunction with other methods?
just that. Just they start, having significant decreases in their autism symptoms, better social skills, less stimming. So that's pretty wild. I think that was a pretty neat discovery.
Is it hard to prescribe a dosage that?
Oh, it just takes a push of a button, except because it's over the counter, it's a vitamin, and it's such a big dose. The prices that I even looked at some Canadian pharmacies last month after we heard about this. It's $600 a month just for that vitamin. But here's the thing. If you go back to our December newsletter, we read it, the references are in there, but the gist of it is that if you do this, apparently almost all children with autism will respond to some extent to this megadose folate, maybe 3/4 of them. But if you have the antibodies, and there's now a blood test for those antibodies, it's not covered by insurance, it runs $200, but then you can make a more educated decision as a parent. And I think we had a parent already sign up and do that. Whose daughter has pretty bad autism, and you got the antibodies, then you have a much higher likelihood of having a response to this $600 a month worth of folate. But here's the other trick too. So if you do have those antibodies too, then you can really go on an ultra strict dairy-free diet, and over the course of months, maybe years, shake those antibodies off. The thing that apparently the molecular mimicry that gets this autoimmune thing going with folate receptors in the brain is that those receptors look a little bit like cow's milk to our immune system. So if these kids are drinking, sneaking a little ice cream at a party, they got a leaky gut, that ice cream, that casein goes into their bloodstream, doesn't stay just in their gut, doesn't get chewed up by their healthy gut microbes the way it should, and ends up stimulating their immune system to make antibodies not only against the cow's milk, so maybe they get some eczema or some other manifestation, but the bad thing is that they start limiting the amount of folate that gets into their brain will help them with their neurological development.
So having this dose of folate could reverse autoimmune issues. My older kids, age 17 and age 15, they're presenting with some autoimmune, Raynaud's, leaky gut.
There's like I've listened to a couple of them. They get over all these summits now online. It gets
Yes.
like, I think there's going to be like a new disorder pretty soon of like a summitaholic. I think, like how many, you have like 17 gigabytes of summits downloaded onto your phone like I do that you still have to watch.
Yeah.
But yeah, the autoimmune disorders like thyroid. Saw a patient this week that had really bad Crohn's disease, eczema, asthma, allergies. I have anxiety attacks now every September just because of and poor Angela, our receptionist, is like, oh no, the EpiPen requests are going to be coming through. Like when I started in practice 30-some years ago, it was like September, like 1 or 2 EpiPen notes, maybe a couple of inhaler notes, but man, then it got to be like off the hook the last few years. Every year I get my kids, I get the note sent home, like there's a child in your class that has severe peanut allergies, don't ever send peanuts to school with your child. We all see that. you can't take an airplane flight anymore and get peanuts right there. That's changed so much. Will taking folic acid or folate settle down immune disorders? No, it works the other way. Getting the autoimmune disorders under control will help you to use folate better if you have these antibodies in your system when you travel on the spectrum. But how do you do that? How do you get rid of autoimmune disorders? Well, that's tricky, but there's like some